Absolutely. And it reminds us, when we were working together with at Roy's training, and we were there with Lori Coulson, who was leading the EMDR training, and we did some auricular points prior to
Mhm.
an EMDR session. There was an active point, and the active point was, in fact, a depression point. And it came up that this was very relevant. The depression point, interestingly, coincides with a physiological point, which is related to the jaw, or the TMJ. It recalled a story from her about having surgery on her jaw and waking up from the surgery and not being able to open the jaw because there was a complication. It was a very traumatic event, but she had not remembered this event. I didn't discuss this with Lori, but I had placed an ear seed on the coach we were working with. Then the point, though, as we were nearing the end of the session, like we had gone several
Mhm.
sets of BLS in, and
Sure.
then you remember that that point became active.
Right.
Like she
Mhm.
actually said, "Hey, this ear
Mm.
seed that you had placed is now, I feel it." She probably
Mhm.
wasn't even thinking about this thing because I put it on earlier in the day,
Mhm.
which may, right, show a very strong correlation of, one, the trauma that
Mhm.
was we didn't target, and two, the connection of how we hold emotions, right, and trauma in our body. TMJ
Mhm.
is
Mhm.
obviously just an anecdotal piece of um, an anecdotal observation.
Mhm.
Um, and certainly we can point to a lot of research on neuro-auricular modulation.
Mhm.
Um, but I wanted to bring this up in terms of what you had mentioned about targeting.
So even before we can even process, we need to regulate somebody's nervous system, and sometimes that can be really challenging. We need a little extra help as clinicians.
Yeah, and the nice
So
thing
you're
with
kind of proposing that.
the neuro-auricular modulation, right? And this is what Shannon is finding in his practice, that what otherwise might take 8 sessions in order to get somebody in a state where they even have the regulation, and in order to be able to begin an EMDR session, he's able to regulate patients already so that by the second session, where they can get started. And how he is doing this is identifying active points, and he knows exactly, because of the training, that he's usually for regulation type issues, right? When we're dealing with exactly what EMDR is trying to get at, but paradoxically also has the biggest challenge with, is offering uh, the kind of balance between hemispheres, right? So that's what bilateral stimulation is all about, is creating that balance between the left and right hemispheres in order to provide the regulation. Yes.
And that has a lot to do with Daniel Siegel's hand model that I told you about. Is when a trauma happens, let's say this is the prefrontal cortex, this is the limbic system, and this is the reptilian brain. When a trauma happens, the prefrontal cortex goes offline, the limbic system goes offline, and we're just dealing with the reptilian brain. They're just not present anymore, Juba. We're not dealing with somebody that's able to be there. So we can't, as therapists, continue our work if somebody is like, "Whoa, I'm floating away." And some people can be triggered by a sound, the slightest thing, and it can be really, yeah, it can be really difficult for therapists. I mean, a lot of therapists go, "I don't even really want to work with the DID." So good with good for you. I actually like working with people who dissociate, because I think it's all about trying to bring them back into that window of tolerance that we were talking about, Duban. So yeah, how
Yeah.
would you go about helping us out with that?
Right. And it must be frustrating because you have the tools in order to deal with dissociation, But
Oh yeah.
unfortunately, you need to first get the prefrontal cortex, like you described in your, model from
Well,
Sieg.
I
Exactly.
want to get the brain a little bit like this.
Yeah.
So, and what we're really dealing with is safety at that point. We're dealing with the polyvagal theory, and the social engagement system is really off. When people are dissociating, it's like I just don't feel safe.
Yeah. And
Yeah.
so
Okay.
with neuro-auricular modulation, what we're doing is we're activating some of the very same mechanisms of action that you're finding that are the mechanisms of action of EMDR. And it's also wonderfully in line with the AIP model from Francine Shapiro, which is basically has the underlying concept of we are helping the body to do what it does best naturally, right? To
Right.
heal itself. So the body is often blocked, has these neural blockages, right? And in part, that is why we're seeing the activity on the ear. Electrical imbalance of the ionization on the skin. And that's how we can detect it with clinical devices such as a point finder. So active points can be found by pressing and finding areas that are tender, but also we can use clinical devices like point finders to find active points. In the case that you're describing, most likely we're dealing with points that will be highly active at the limbic system on the ear. And there we can get very specific. We can see points that are active in the cingulate gyrus, in the amygdala, in the hippocampus. And we can stimulate these points, giving signals to the nervous system and helping to overcome the blockages. It kind of reminds me of a discussion we had yesterday, Tasia, with Dr. Liu in China, who is working at the TCM Hospital of Preventative Medicine. And what he is finding with patients often is just being present and holding space with a
Totally.
client and touching their ears actually develops a real kind of connection to build trust.
Yeah, I
What is
would imagine
interesting
so.
with
I
the
mean,
ear is when we stimulate the ear, because we are finding the
mm,
very issues that are
right.
coming up dynamically in the
Right, you're
body,
really connecting to somebody that
we
way. They're like,
are
"Oh my gosh,"
actually
like, it's like
connecting.
when you
Exactly.
resonate with somebody with an emotion
Yep.
and they feel heard and gotten.
Finally feel
When
understood.
you
Yeah.
like when I'm seeing a body worker, like a masseuse or something, and they connect to the pain part where I'm in pain and I'm releasing that, it's like you just feel this connection to the person that you're working with. So yeah, for any
So
healer, with whether it's somatic or emotional, or to have that connection, just so that the body knows that it's present in this day and space and not in the past. And you're getting to a level of the body and stimulating points where they're activated, and the realization through that, we don't understand how the body realizes things, and through our stimulation of a point, the body realizes it's safe, and now you, by being there and activating it, can really help that safety, that comfort, that connection that you're building with the client. um yeah, I think that's really beautiful, Devon, what you said.
a landing page, and that's where if you put your email in there, then of course you get resources related to this. Also on the landing page are videos that provide introduction to this and a link to watch how this looks in practice. And that's with Shannon, who we were talking about.
Yeah, and also keep in mind, to me, watching Shannon's a little intimidating 'cause it's so beautiful what he does. I just admire it, and I also want to keep in mind that you don't necessarily need to do it like he does, and I think that's true for any modality we learn. Um, like you don't need a person on the table. You don't necessarily need to use the laser. You don't, So I just want to put that out there that it can look different.
Yes, exactly. It can. And, although Shannon is using a laser, right? We're simply using an ear probe, okay? And there are then clinical ear probes. They look like dental probes. They have a non-sharp tip. It allows us to have the specificity to target a point or manipulate a point without breaking the skin. The main thing, we want to not have any devices that are going to be breaking the skin. That's not the intention. And then by stimulating the point, we we'll ask the client, right? Do you have an active point? I mean, do you feel tenderness when I'm pressing on this point, right? If there is,
Every time I hear point, I think I have to be an acupuncturist. Every
let
time
me
you
say,
say point, I'm like, do I have to be an
no,
acupuncturist?
I will change the language. Reflex zone, a reflex zone. Okay, so
Oh,
these
I
are
like that.
reflex zones on the ear that are projecting what the brain is mapping neurally, and that's why these reflex zones become active.